polyarthritis, that is, it affects more than one joint. यहाँ चाहिँ एउटा मात्रै joint affect भएको छ, त्यो पनि चाहिँ के त भन्दाखेरि चाहिँ right big toe affect भएको छ. So it is very unlikely to be rheumatoid arthritis. Now let's talk about acute gouty arthritis. It's likely to be acute gouty arthritis because this is also precipitated by drinking, है त, by drinking alcohol, है, alcoholic के भन्छ gout भएको patients are they should avoid having alcohol because it could precipitate a flare of gout, है त. Now there is something called, okay, अर्को चाहिँ के छ, septic arthritis. So septic arthritis could also be one of the causes, but septic arthritis ko कुनै पनि precipitating factors are not there. Like he hadn't had any other infections that could have gotten to his bones, हैन, कुनै कहिलेकाहीँ स्किन इन्फेक्सनबाट पनि हुन सक्छ, कहिलेकाहीँ चाहिँ हैन ब्याक्टेरियाबाट, है, any other infections could go into his blood and actually infect the bone. So that's also not likely in this case, hey, especially because he has a history of alcohol ingestion. So acute gouty arthritis is very much likely, right? And the last one here is calcium pyrophosphate deposition disease. So this disease, hey, you must have heard about it. यसलाई चाहिँ हामी pseudo gout पनि भन्छौँ because the symptoms are very much similar to acute gouty arthritis, right? So that is why we call it pseudo gout. But यो पनि होइन because the site, right? The site is different. Right? Calcium pyrophosphate deposition disease mostly occurs in the knee, right? Most of the time, but it is also monoarthritis. It also affects a single joint. तर possession चाहिँ different हुन्छ, है. Possession चाहिँ usually चाहिँ के छ भन्दाखेरि large joints मा हुन्छ. Whereas acute gouty arthritis को चाहिँ एकदमै सबैभन्दा commonest site भनेको चाहिँ के हो त, first metatarsal joint हो, है. I mean first metatarsophalangeal joint हो. So as it has also been mentioned here, it occurs in the right toe, right? So it is a metatarsophalangeal joint over there. Hey there. So acute gouty arthritis को सबसे common site के होता metatarsophalangeal joint, whereas calcium pyrophosphate occurs in the large joints, especially in the knee, right? So this is not pseudo gout and it is acute gouty arthritis. So how do we make a definitive diagnosis? So remember that there has been written a definitive diagnosis and not just diagnosis, right? We can diagnose gout by all of these, right? By serum analysis or sanguine fluid analysis, ultrasonography बाट पनि हुन्छ, X-ray बाट पनि हुन्छ. But how do we make a definitive diagnosis? That is via the synovial fluid analysis, right? We aspirate the synovial fluid and then we look for the uric acid crystals itself, right? So we can make a definitive diagnosis that it is gout. So what is gout भन्दाखेरि चाहिँ gout भनेको चाहिँ it is the accumulation of uric acid crystals in our joints, होइन? Synovial fluid मा चाहिँ uric acid crystals हुन्छ. There is one thing called hyperuricemia. Hyperuricemia भनेको चाहिँ it's just a term for elevated uric acid, right? But when it comes to gout भनेको चाहिँ के हो त भन्दाखेरि यो uric हाम्रो elevated uric acid चाहिँ गएर के भयो त हाम्रो jointsहरुमा पनि affect गर्यो भने चाहिँ we call it gout, है. Jointsहरुमा crystals बनेर if it starts causing us pain and if it starts showing us symptoms of inflammation, that is what we call gout. But hyperuricemia is just simply the elevation of के त भन्दाखेरि elevation of uric acid in our serum. So definitive diagnosis is के भयो त, it's not serum analysis, है. Serumमा there could be uric acid could be high, but still the patient could not be having gout, है त. सबै uric acid high हुँदैन, we cannot call it gout. The person should be showing symptoms of gout. That is, the person should have के त भन्दाखेरि urate crystals in the synovial fluid. So यसमा चाहिँ answer हो synovial fluid analysis. Ultrasonography बाट पनि we can actually guess we can actually tell if it's gout or not है it shows कि तब बंदा bone erosions are देखिन्छ ultrasonography में पनि है and that is not just specific to gout है bone erosions are obviously calcium pyrophosphate में पनि we can sometimes find it so it is not specific है we cannot specifically tell but we can actually see some of this some of the findings of gout है the ultrasonography में अनि interfacious material हरू देखिन्छ x-ray में पनि we can find punched out bone erosions है x-ray में पनि punched out bone erosions that is specific to gout but still it does not help us make a definitive diagnosis that is done only by synovial fluid analysis right now, as we said earlier, gout could be one of the most important differential diagnosis भनेको त्यो के छ त भन्दा pseudo gout छ है यसमा चाहिँ के हुन्छ त difference भन्दाखेरि obviously gout को this is यो चाहिँ site भयो as I told you earlier है first metatarsophalangeal joint is the site for gout whereas pseudo gout मा चाहिँ it's most of the times it's knee right it's the knee both of which are acute monoarthropathy. Okay, it occurs acutely most of the time, right? And a monoarthropathy means it affects only one joint, right? Gout से की conditions में होना सकता था, especially it occurs in the male gender, as our case over here, hey, impaired renal function में होना सकता because obviously our kidney is supposed to throw all the waste products, है ना? Waste products are throw गर्नुपर्छ so uric acid चाहिँ when the kidney is not being able to throw त्यति बेला पनि gout हुने भयो obesity मा हुन सक्छ metabolic syndrome मा हुन सक्छ or if a person could be having red meat होइन person चाहिँ is consuming too much of red meat alcohol seafood है also gout is also related to thiazide diuretics है tumor lysis syndrome मा tumor lysis syndrome चाहिँ कस्तो भन्दाखेरि चाहिँ when we are having होइन के भन्दा okay let's talk about tumor lysis अलिकति when we are having chemotherapy when okay okay now के हुन्छ त भन्दाखेरि चाहिँ when we are treating tumor with chemotherapy when the tumor gets lysed then के हुन्छ त uric acid is released है into the circulation त्यसले गर्दाखेरि पनि it can precipitate a gout attack है त after chemotherapy hey when the tumor is being lysed है त pseudo gout चाहिँ कस्तो कस्तो केसेसमा हुने भयो त भन्दाखेरि hemochromatosis when there is iron deposition in our body hypophosphatemia मा osteoarthritis possible हुन सक्छ hypothyroidism मा हुन सक्छ again pseudo gout is the deposition of calcium pyrophosphate right okay now let's talk about something है त हामी we had talked about कसरी चाहिँ definitive diagnosis गर्ने भनेर right it was related to के त भन्दाखेरि चाहिँ aspiration of the synovial fluid and then analyzing it synovial fluid analysis here right so what do we do after we aspirate the synovial fluid भन्दाखेरि चाहिँ we watch it under the microscope है polarized light microscopy भन्छौँ हामी we watch it under that अनि त्यसमा चाहिँ goutमा चाहिँ के देखिनु भयो त भन्दाखेरि goutमा चाहिँ we are going to see negatively birefringent needle crystal है negatively birefringent needle crystal but in case of pseudo gout we see के त positive birefringent rhomboid crystal यता चाहिँ crystalको shape needle shape हुन्छ goutमा है needle shape को यसमा चाहिँ rhomboid shape को crystal हुन्छ birefringent चाहिँ यो चाहिँ negative birefringent हुन्छ यसमा चाहिँ positive birefringent हुन्छ that is it has two refractive indices है index यो चाहिँ refraction चाहिँ it shows two refractive indexes so positive birefringent okay now as I said earlier x-ray finding in gout is punched out periarticular erosions है यो चाहिँ goutमा भयो pseudo goutमा चाहिँ chondrocalcinosis हुन्छ है there is also inflammation of our cartilages किन भन्दा because of the deposition of calcium pyrophosphate so chondrocalcinosis हुन्छ x-ray findingमा so obviously treatment we'll talk about it later है त we'll go with let's go to another question, right? First matter case आता polarized microscopy as we have as I've mentioned it before है ना polarized microscopy of the synovial fluid reveals क्या होता है this is the case of gout so polarized microscopy of synovial fluid reveals so it is needle shaped crystals right all the three options are related to keta pseudo gout right or calcium pyrophosphate deposition disease, right? And we also call it calcium pyrophosphate deposition disease. So you order written options such as typical rhomboid-shaped crystals, positive birefringent crystals, and calcium pyrophosphate crystals. This all occurs in the gout. Now there is something called xanthine oxidase inhibitor used in the management is. So among these options, which one is the xanthine oxidase inhibitor? So I remember this question being asked in my NMCLE. Miru Talimate, they had asked this question and they had the similar kind of options in here. Right? Xanthine oxidase inhibitor is the key word. Okay. So let us talk about xanthine oxidase. Let us talk about this a little. Right? Xanthine oxidase inhibitor is the key word. Okay. Our body matter, our currents are so they get metabolized into the uric acid, right? To gardahin, because steps are there is something called hypoxanthine, right? Purine, where a conversion for the hypoxanthine to xanthine methanolate and is xanthine to uric acid methanolate. There is an enzyme that is required that is called xanthine oxidase, right? This enzyme is required for the conversion of hypoxanthine to xanthine and conversion of xanthine to uric acid. So xanthine oxidase inhibitors, it's allopurinol and tebuxostat. Right? These two are the xanthine oxidase inhibitor. It inhibits the conversion of hypoxanthine to xanthine and xanthine to uric acid. So when we use this drug, what's going to happen? Our uric acid level is going to decrease. Right? So in this question that they have asked, so which of these is xanthine oxidase inhibitor? So it is febuxostat, right? Indomethacin भनेको चाहिँ एउटा NSAID हो, है? Colchicine, what is it? It's actually के गर्छ त भन्दा it modulates the inflammatory pathway of gout. So in this way, it decreases the inflammation, right? These two medications are used especially in the acute flare of gout, right? Acute flare. But medications such as febuxostat or simply xanthine oxidase inhibitor has no role in acute flare of gout, right? Because acute flare of gout is all about pain and swelling हुने भयो हैन pain र swelling लाई चाहिँ यो xanthine oxidase inhibitor ले reduce गर्दैन. The only thing it's going to reduce is it's going to reduce furthermore production of uric acid, right? There is already uric acid deposition in our joints. So acute flare मा चाहिँ के हुन्छ त भन्दाखेरि acute flare मा चाहिँ this is not going to work, right? Already deposition भइरहेको छ. So the only thing we can do is we can furthermore decrease the uric acid production, right? So you say we need to keep having this medication, right, all the time so that we don't have an acute flare of gout. But then after we have it, this medication doesn't really help, right? But the medication that helps in the acute flare is indomethacin and colchicine, right? And there's another drug that is called pegloticase, है pegloticase ले चाहिँ के गर्छ त भन्दाखेरि चाहिँ यसले चाहिँ uric acid लाई catalyze गर्छ into a soluble purine metabolite, है. So soluble purine metabolite, your purine metabolite form गर्न help गर्ने drug is के त pegloticase. What does it do भन्दाखेरि चाहिँ यसले चाहिँ it catalyzes uric acid to के त water soluble purine metabolite. And what do we call it? We call it allantoin, right? Water soluble purine metabolite. Allantoin bottom. So that's our purine metabolite. It gets easily excreted into the urine. So what should be avoided in gout? So this is a very easy question as I've mentioned before. Uric acid, it comes from what? Purine. So purine containing food should be avoided in gout, either. Such as I've mentioned before, alcohol, bio, red meat, oil, and the recent study actually shows that fructose containing food should also be avoided in gout है त recent study has also shown some relevance है in this some association between fructose and gout. Okay, now let's talk about another case. Right, this case is of a 57-year-old male patient. Right, known case of rheumatic heart disease for 6 years. Okay, 57-year-old male patient, Aniketa, rheumatic heart disease for 6 years for the patient. Right, presented to the ER with cough and shortness of breath. Okay. On examination, okay, cough and shortness of breath could have vast majority, I mean, a variety of diagnosis, right? Cough and shortness of breath. But since this is a heart patient, so it could be of the etiology could be related to the heart, right? Now, on examination, when you examine the patient, what do you find? You find jugular venous pressure was raised, right? This Pashiketa Banda, you also find bilateral pitching edema. And it is especially bilateral fine crepitation on the chest auscultation. Chest auscultate that you found out bilateral fine crepitation. And you also found out hepatomegaly when you were examining the person's abdomen. So all of this, what idea does this give you? You सब symptoms are related के तेरा direct cause होगा. So I will break it to you, right? These all are the symptoms of congestive cardiac failure. If you look at it closely, right? Kithata jugular venous pressure raised on Pashitahi. The right side of the heart is not working well. Bilateral pitting edema. Hepatomegaly. The right side of the heart is not working well. Right? Bilateral fine crepitations of the chest. Also, the left side of the heart is not working well. Right? Cough, shortness of breath. So we'll talk about it in detail. Right? Okay. Now there is a question. Which of the following is not a feature of left ventricular failure? Right, left ventricular failure. So let me explain it to you by this figure itself. Right. So left ventricular failure matter क्यों होने वाला था on that. Okay, let me start with the right ventricular failure. Right. So what happens when our right ventricle is not being able to pump blood into the pulmonary artery? Blood is going to get accumulated from all the places, right? Because the right ventricle, it drains blood from all parts are all parts of our body nito. So blood से data accumulates when our right ventricle is not working. So what's gonna happen if from the inferior, okay, from the liver, hepatic veins, it drains into the inferior vena cava. So obviously when our right ventricle is not draining, not being able to pump blood, blood fake liver में अपने accumulate पाएगा, hepatomegaly होने वाली है ना, so let's say some cardiac cirrhosis पनि भन्छ, right? Cirrhosis because of a cardiac cause. So right ventricle is not being able to pump blood, so the blood accumulates in the liver, right? Liver में पनि kinata wala hepatic vein carries blood by the inferior vena cava into the right side of the heart. So it's going to accumulate everywhere, not just the liver. Hey, okay, liver ma when it's going to cause cardiac cirrhosis, right? त्यसपछि के भयो हाम्रो jugular veins मा पनि हुने भयो. So jugular venous pressure rise हुने भयो obviously हैन यहाँ jugular veins माथितिर हाम्रो तल in our legs it's going to cause bilateral pitting edema. So all of these are the signs of right-sided heart failure. Hey, right-sided heart failure. Just remember, right? Now let's talk about left-sided heart failure. So left side of the heart with the blood received from the lungs, right? Lungs part of the pulmonary vein it's receiving blood and it's supposed to pump blood to everywhere, right? The left side of the heart. So what happens when the left ventricle is not working well? The first thing is our cardiac output is going to decrease, right? So what happens when our cardiac output decreases? What happens? Symptoms are oliguria, the person is going to feel dizzy, I know. यो सबै symptoms are left sided heart failure को हुने भयो है. अर्को चाहिँ के भयो त left sided heart failure भएर चाहिँ के हुन सक्छ त भन्दाखेरि हाम्रो चाहिँ ब्लड कता accumulate हुने भयो त लङ्समा गएर accumulate हुने भयो by the pulmonary veins, right? So, so there's going to be backflow of blood, right? Because our left ventricle is not working. त्यही भएर चाहिँ लङ्सहरू चाहिँ प्लेथोरिक हुने भयो है. There's going to be accumulation of fluid in the lungs that's going to cause pulmonary edema. So when there is pulmonary edema, what's going to happen? The person's going to cough, right? He's going to cough. It's going to be dyspneic. And he's going to have something called paroxysmal nocturnal dyspnea, right? Paroxysmal nocturnal dyspnea. So why is it called that? Used especially when the person is sleeping त्यति बेला हुन्छ है. किन सुत्दाखेरि हुन्छ त भन्दाखेरि सुत्दाखेरि चाहिँ के हुन्छ त भन्दा parasympathetic activity over activity हुन्छ नि त. Parasympathetic activity increases when we are sleeping, right? So what does parasympathetic activity do भन्दाखेरि चाहिँ it decreases our heart rate, right? It furthermore decreases our heart rate अनि त्यसले गर्दाखेरि चाहिँ के हुने भयो त फेरि के हुने भयो भन्दाखेरि cardiac output is going to decrease अनि त्यसपछि के हुने भयो there's going to be furthermore accumulation of fluid in the lungs, right? It's going to cause dyspnea. That's why we call it paroxysmal because it occurs sometimes when you sleep and not there is intermittent attacks of it, right? Paroxysmal nocturnal dyspnea right? Because it occurs especially at night when you're sleeping. Or because there is something called orthopnea, typically occurs because of left ventricular failure. So when you're lying down, the person actually, when the person is lying down, he gets dyspneic. Obviously, venous return increase in when the person is sleeping. So venous return increase by the person is going to feel orthopneic when venous return increases. Obviously, हाम्रो चाहिँ cardiac output पनि increase हुने भयो. Venous return increase भएपछि cardiac output पनि increase हुने भयो. But because of heart failure, our left ventricle is not being able to pump the blood which it should. फेरि पनि के हुने भयो त there's going to be accumulation of blood in the lungs, so that's going to lead to orthopnea. So I think I'm taking a lot of time, right? If you want me to discuss it faster, you can tell, because there's not much time to waste, right? Okay. The third question is hypoglycemic drug of choice in cardiac failure. Kun ho ta hypoglycemic drug of choice in cardiac failure, right? It is clear from the question, from the scenario that the patient has cardiac failure, right? So cardiac failure ma चाहिँ hypoglycemic drug of choice kun ho भन्दाखेरि is it metformin, is it insulin, empagliflozin, right? And this is sulfonylurea. The answer here is empagliflozin ho, right? Empagliflozin भनेको चाहिँ कस्तो kind of drug हो भन्दाखेरि it is sodium glucose co-transporter inhibitor, right? So it works in our proximal convoluted tubule मा चाहिँ यसले के काम गर्छ त भन्दाखेरि it inhibits the reabsorption of glucose as well as sodium, right? दुईटा कुरा inhibit गर्छ यसले. Inhibits the reabsorption of glucose as well as sodium. So by inhibiting the reabsorption of glucose, it helps in diabetes and causes hypoglycemia. And by inhibiting sodium reabsorption, it also helps in the cardiac failure. Okay. So I missed one more question over here, question number 2, which of the following is a marker of cardiac failure, right? Is it troponin? Is it CKMB? Is it something called NT-proBNP? Or is it ESR, right? So the answer here is, I'll give you the answer real fast because I don't want to be wasting more time, right, of yours, because you have to study real fast. I know that, right? यसको answer चाहिँ NT-proBNP हो, है. NT-proBNP भनेको चाहिँ के हो त भन्दा N-terminal prohormone of brain natriuretic peptide, right? Cardiac failure को बेलामा चाहिँ के हुन्छ त भन्दाखेरि हाम्रो ventricle ले चाहिँ के release गर्छ त brain natriuretic peptide release गर्छ है. So the name itself natriuretic peptide भनेबित्तिकै यसले name ले नै भन्छ कि what does it do भन्दाखेरि it increases the excretion of sodium natriuretic, है सोडियमको एक्सप्रेसन चाहिँ युरिनमा गराउने भयो सो NT-proBNP चाहिँ के हुने भयो त कार्डियक फेलियरमा चाहिँ इट इन्क्रिजेस है इन आवर सेरम इफ वी डू दिस टेस्ट चाहिँ इट इज एन इन्डिकेटर यो हाई हुनु भनेको चाहिँ इट इज अ डेफिनेटिभ इन्डिकेटर अफ कार्डियक फेलियर है Now let's come to troponin and CKMB. यसले चाहिँ खाली infarction denote गर्छ and not exactly cardiac failure है myocardial infarction मात्र denote गर्ने हो है ESR चाहिँ infection ko बेला increase हुन्छ so the answer here is NT-proBNP if this is high that means the person has cardiac failure and there is another question here true about the sputum color in case of pulmonary edema so what do you think is the sputum color okay I'll give you the answer right away it's pink frothy sputum right when a person has pink frothy sputum the person could be having keta bandakiri pulmonary edema hey so okay chocolate colored sputum चाहिँ Klebsiella मा देखिन्छ है Klebsiella infection मा हुन्छ chocolate colored sputum frosty sputum चाहिँ pneumococcus मा हुने भयो and mucoid sputum there is a wide variety of diagnosis है wide variety of conditions that could cause mucoid sputum such as chronic bronchitis asthma मा पनि हुन सक्छ है so there are many other things that could cause mucoid sputum. There are chocolate colored sputum that is specific to Keta, Bandakiri Klebsiella, rusty sputum is specific to pneumococcus, and pink frothy sputum is specific to pulmonary edema. Right? Pink because there's also blood in there, hey, blood tinged sputum, so it is pink and also mixed with so okay, pink frothy sputum. Okay, let's. So that's it with this case. Let's go to another case, Aida. So there's another case of a 45-year-old female patient